is on a period, exactly like our payoff line as it is. Welcome to Spring Clinic, a house flagship of Western Spring Television. I am Timitope Ajijola. Children's resilience and or ability to overcome adversity and hardship depend on the ability of caregivers to provide consistent safety and support. So that means that parental or caregiver well-being is critical to the health and well-being of the child. Families that are experiencing socioeconomic stress, loss, that is of livelihood or loved one, children with special, that is medical, social, emotional, physical needs, etc., are under tremendous stress. And one thing that is overlooked is parental or caregiver well-being. There's always pressure on parents and caregivers to do more, and it has been really hard for a lot of them to manage and or achieve that with a tremendous amount of pressure they've been experiencing on all fronts. In continued partnership with Uniosun Teaching Hospital, Oshobo, today we'll be discussing the topic caregiver and parental, parental mental health and child upbringing with the esteemed Dr. ADEOLA ODUYEBO. She is a consultant psychiatrist and a fellow of the National Postgraduate Medical College of Nigeria, NPMCN, in psychiatry and currently serves as a consultant at the Uniosun Teaching Hospital. Dr. Juyebo is also the Vice President of Destiny Development Initiative, that's DDI, a prominent non-governmental organization working in strategic partnership with the Osun State government. Through this role, she contributes significantly to the planning and execution of community-focused projects in areas such as public health, youth leadership development, education, women's empowerment, and social welfare. Her work with DDI has seen her collaborate closely with the Osun State Ministry of Education and Ministry of Health to advance policies and programs that support marginalized populations, enhance mental health awareness, and improve educational outcomes across the state. In addition to her clinical and developmental roles, Dr. Oduyebo holds leadership responsibilities in her faith community, where she mentors emerging leaders and supports spiritual and personal development. Thank you for making a return on Spring Clinic, Dr. Ma.
Thank you so much. Good afternoon to everyone.
Good afternoon to you too. All right, so we've been talking about mental health. People out there have talked about mental health, here and there. It's beginning to be a very consistent topic, showing around people's discussions. Before, mental health never used to be something we talk about in these climes. But what is mental health? I mean, if people talk about mental health, is it the same as having a psychiatric issue? I mean, what is mental
So thank you so much. I will start by first defining what health is.
health?
And health is a state of physical, social, and mental well-being, and not just the absence of disease or infirmity. That means it's the mental health of an individual is very important if the person is is going to be termed well.
Mm.
And so let's now look at how WHO defines mental health, which is a state of well-being in which an individual can realize his potentials. That means he's able to know what he can do and what he can't do. It's not everyone that knows what they can do,
Mm.
depending on what the state of their mental health, depending on the exposures or some of the challenges they've gone through. Two, is able to cope with the normal stresses of life. There are normal stresses that people go through, including what is happening in the country now, the socio-economic problems. There is no nation in the world that don't have not had a time of depression. and even the well-developed world also have their times of depression, and every economic depression, that's what I mean. So the capacity to be able to cope with those stresses, which at that time seems universal for everyone, or normal stresses of life, which includes going to school, change of school, have children, get married, and all that. So that's two. The individual will should be able to cope with normal stresses of life. Then the individual should be able to um, adapt to situations.
Okay.
That means the person can learn well and work well. There are people who, once there's a change, there's a problem. And so your mental health is said to be sound when you can adapt to situations. And then lastly, is said to be defined as your capacity to be able to contribute meaningfully to your community. You know, we live in a world where it's me, I, and myself. And if all about your life is I, me, and myself, then there's something wrong with your mental health, because you must be able to go beyond yourself. You must also be able to go beyond your immediate family and also be able to contribute meaningfully to the community where you live, be productive, which includes your workplace, your capacity to be productive at your workplace. And basically, that's what our mental health is defined.
All right.
And so it's not, many
Yeah.
people think the myth is that is the shepherd man on the road, the man
Yes.
with the dreadlocks that is so dirty, and they call him madness. And so when anybody tries to say you see a mental health physician or a psychiatrist, they ask, am I mad? I'm not mad now. I still have the story of a young lady who was taken to one of the teaching hospitals, and her behavior had changed, and the person she was with felt they needed to be assessed. And as she got to the mental health facility and she saw psychiatric, she just turned back and started running, say, we're me to you. You know, it means that, okay, she just felt that this is the last, this is the straw that should break the camel's back. That's the last straw, and I don't think I'm as bad as they think. So it's not all about that. There's so many types of mental health problems.
All right. Before I go to the next question, let me just, drawing from what you just said about the disheveled man on the street, and all of that. Is there a difference between a person that is just having struggle, stress mentally, and that person on the street? Or is one the basic and the other is advanced?
Okay. Really, you will see that the person on the street is advanced. And on what basis is it advanced? Nobody took care of it when it was um, much, when it was in the much more smaller level. There are so many people who could have been on the street, but that they went to the right place and they were managed by the right set of people. And that's why they are not. But there are different types of mental illness.
Okay.
There are some that may never get people to the street. But
Okay.
yes, it's mental illness. For example, people that have anxiety disorders may never get the shepherd, but they are not settled and they are very unproductive. So some of them may even have some of those things and may really not be at work. And once they are not at work, they are unable to contribute meaningfully even to their immediate family, and they are unable to be as productive as they should be, the immediate family. But there are so many other people who are present in their homes at the workplace, doing so well, getting married, that if nobody took care of them when it was at a much smaller level, it would be on the street.
All right. This particular program is focusing on parents now, parental health and caregiver health. It has been always the child health, mental health and all of that. But now let's talk about parents now and caregivers. What are the boxes that we could tick, to show that this parent or this caregiver has a balanced mental health? I mean, we've seen videos of caregivers hitting hard on children. I mean, children within the age range of 0 to 5. What is the problem? How would you see a person and say, okay, this person has a balanced mental health and this person
Does not. Okay. Let me start with the one without balanced mental health. Caregivers are meant to be people who take care of children.
Yes.
And parents are also caregivers because they're meant to help the child grow up
Nurture
well
them. Yes.
and nurture them, not just physically, but mentally, socially, and all that. And it's even in the nurturing of the social, the psychosocial well-being that is the reason why the government became particular about children getting into higher institutions too at too early age, and then getting into serious trouble because they are unable to they are unable to cope or make logical decisions, and so get into a lot of trouble. So parents are there to help, to care. That's basically, caregivers are there to care. So when a caregiver is doing anything less than care, then there's a problem. For example, when you have caregivers who neglect the children and they can afford what the child should have, but they refuse to do it. You have people who are probably parents or caregivers who, in the bid to punish the child, they deny them of their necessities, what they should have, what they are entitled to. Such a parent has a problem. You know, the parent may not need medications, but the parent has a problem. Or may not need medication, but the parent has a problem, depending on what other symptoms go along with that decision. So you have parents who also abuse the children physically. You know, so when it's beyond the reasonable spank or the reasonable beating with a cane. In Africa, we do be beat with
Speaking of
cane.
that beating, let's have this video come up of that we have there. It's showing, the battering of a child. Yes.
Once a child is intentionally or even non-intentionally harmed, then, or accidentally or non-accidentally harmed, then that child is being abused. You know, and when so once the child is abused, that's what we call physical abuse. So you have scenarios in which parents they beat the child, or the caregiver beats the child with um, very hard weapons, or things. Sometimes they give them marks. I was doing a study once on children being abused, and for some of them, I found out that the parents, their caregivers could paint or clean or rub on their whole body pepper, you know, just because they probably did something they should not have done. That is what is called physical abuse. You have some that emotionally abuse children, and it's such that they get them to a point of those children feeling unhappy most times, and they some with curses and abuses. Some who are not living with their direct parents are told words that they make them feel like, I wish I were with my parents, or probably lost their parents here and there. To have the physical, then sexual abuse, which is very terrible and bad, and then you will have children who have gone through that. And so if a caregiver inflicts such on any child, then there's something wrong somewhere. So either the person has a mental health issue of any kind, which could be psychosis, it could be depression, it could be a personality problem, and all that. We have had people with depression who, in the bid to save the child, they felt it was better they destroy the child. And so if such children don't die, we end up knowing that, okay, these children were abused. But some have gotten to a point of homicide, of even getting rid of those children, because it felt that that is the way they can use to protect the child because of the state of their mind. So the caregivers who do act in any way that is abusive on a child, it will end up being negative, and such people's mental health should be checked. You know, one of the types of abuse that many people don't know is abuse is domestic violence. You know, is another type of child abuse where you have parents um, who have conflicts all the time, sometimes with
The
verbal,
physical.
yeah, sometimes physical, and they don't care. They don't care when they see the child even cry. They don't care. They are so particular about what they're trying to pass across to the intended the partner, because they of the state of their mind, probably because of anger and all that, that they don't know that they are abusing such children, and many of those children are at risk of mental health problems. We have had people who, at times, some of them even get to the stage of being adults, and they come up with mental health problems, and they came from dysfunctional homes where things are not working, or they have caregivers that have been very difficult.
All right. So when you see a particular parent now or caregiver, what shows you, what signs would you watch it for to say that this person is mentally whole or balanced?
Okay. Well, if someone accidentally harmed a child, physically abused a child, you will find that the person has remorseful, the person is sorry, the person wishes not, the person looks for how as much as possible to
Make
cover up, make amends, and apologetic and all that. But when you see one who has a problem, then you will find out that such a person may not be remorseful. Such a person will harm the child even more than the age of the child. I think I have a picture of somebody, of a child that was sent to me, that had the forehead really swollen because his mother, a 5-year-old, the mother hit him so hard that, and then had also displayed some other symptoms in the home. So you will find out that those expressions of those symptoms may not be just for that child, maybe even for other members of the home, including the spouse in the home. But some of them have what we call delusions, which are beliefs that that people have. Some may use the word false beliefs that people have, that not reasonable, and and yet it's held on so tenaciously, so in such a way that it breaks, it's out of reasoning when you're talking about the person's cultural background, the person's religious background, the person's educational background, and the whole search. I've had experiences with mothers who probably have specific delusions against their children that will make them think that that child wants to harm them, and so the actions they take will is on how they will also harm the child, and so they at times physically abuse the child, they emotionally abuse the child, and they keep picking on that child, especially women who have what we call delusional disorders, or even those ones that have schizophrenia. But some of those people may also have other symptoms, delusions to other members in the home, delusions and beliefs are not that are not in tandem with reality. Other members in the community, they are very aggressive when they are in contact with those people, and then some of them gets to the point that they are not even functioning at work. At home, they are not very useful. At work, they are also not useful, and so you can and then they are not relating well with the community that they are in. And already defined mental health as a situation in which you're also productive as far as your community is concerned. So when you see that, you know that something is probably wrong with such women. And then even personal care for themselves they may be poor. They probably may starve the child. You can imagine somebody who says a child will fast. In fact, one that we had contact with as a hospital recently said the child was going to fast for 1 week, and so it took the neighbors to come and rescue that child from the long fast. She will lock the child in a 4-year-old boy. She will lock him and go out and then come back. So it took the neighbors to rescue that child, and they had to call significant persons in the person's life, and then we had to come in and then admitted the person, even when some of them behave as if really nothing is wrong outside the sphere of where their delusions are. Such persons will be said to have mental health issues.
All right. We'll be taking a quick break now, but before we go, what are the causes? I mean, a person doesn't just wake up, I think, and say that I want to maltreat this child. What causes, that shift in a person?
Mental health has the number of um, causes, mental health causes and causes of mental health problems, and we should be enlightened and we should know. One very strong one is genetic. In
Oh,
fact, some of the mental health problems have been found to will have very high irritability rates, like the schizophrenia, for example. So it's passed down. And so whether an adult or a child would have it simply because it's a genetic thing. It's just the same way someone, somebody in someone's home have hypertension or diabetes
mm.
and connective tissue diseases and all sorts, and then those things are passed
Oh,
down. And so some suddenly find out that their behavior changed. Some are aware that something is wrong. For example, when
okay.
somebody starts listening and hearing voices of persons she
Mm.
can't see, or somebody is said to be talking to people that are around that are not sane, or somebody now starts accusing people around that you said this and nobody
Mm.
said it.
Mm.
I still remember a young lady who said, who went to the hospital with her mom, and she said the nurse said this, and the mom said no, the nurse didn't say that, because
Mm.
at that time they were all there. She was the only one. Then they had a number of episodes like
Mm.
that. Was when they now said, oh, something is definitely wrong with this person. So the genetic factor is a
Mm.
very strong one. Then another one can also be the parental factor. We're talking about children who are abused
Mm.
in any way. Children who are abused in any way can come down with mental health problems,
Mm.
And then we're also talking about children who, for some, even overcaring parents who shield their children from normal stresses of life.
So that could also be
Yes, yes,
oh.
overcaring. And so when we look at intelligence, for example, you have the normal cognitive intelligence, you
Mm.
have emotional intelligence, you have the social intelligence, and one very strong one is adversity intelligence.
Mm.
And found that people who have very low adversity intelligence, that means their parents shielding them from every form of stress. And so when they have any stressor come their way as they grow up, it's strange to them,
Mm.
and for that reason they cannot cope. They have not built what I said, what we call resilience, the
Mm.
ability to cope in tough times. And we're in a world that will naturally have tough times. We're in a nation, Nigeria, that is
Mm.
full of tough times.
Mm.
And so it's not that you're going to push your children into
Yeah.
adversity deliberately, but when when they face certain
Mm.
challenges that you know is not going to harm them, you allow them to go through it. So such overcaring parenting
Mm.
can also affect them, and that's then the undercare, which is
Yeah,
neglect, which I said
negligence, yeah.
earlier. Then we also have children who have certain types of temperaments, children who still have tendencies to be antisocial, crime
Mm.
here and there, children who have tendencies to be impetuous, those ones who have tendencies for violence, some who have parents who are not so involving in their lives, and they have what we call or who have parents who probably have mental illness. A parent having mental illness and the effect on the child if that child is not rescued by a support team, which could include the relations of such, have also have tendencies for that. Children who go through stresses like loss of parents, separation of parents. I just talked about domestic violence,
Mm.
things like that. Then, as people grow up, which because we're not talking just about children, we're also talking about the caregivers that can
Mm.
come down with any kind of illness. We also have people who go through life events of any sort,
Mm.
life events of any. So some lose
All right.
all that they have suddenly in one day. Then we also have people who take drugs,
Mm.
psychoactive substances like the Colorado people smoke here and there. I mean, any of them can predispose people to those kinds of to any kind of mental illness and so. Then chemical imbalances. What now causes the chemical imbalance? May not we may not particularly be able to say, but
All right.
we found out that from people who are exposed to mental illness problem who are at risk may have some form of
Chemical
chemical
imbalance.
imbalance that may get them into those kind of
Mental.
troubles. Yes.
All right. All right, dear listener. Viewer, we've been talking about mental health and the state of caregivers' mental health and parents as well. We'll be taking this quick break. When we get back, we'll continue. Still.
What's cute, harmless, and depends on its mother for food and protection? Well, me of course, but also a shy little creature called the pangolin. Hundreds of thousands of pangolins are hunted and killed every year just for their meat and scales. If we continue this way, the pangolins will soon disappear. We can't allow this to happen. Tell your families and friends to say no to illegal bushmeat from pangolins and other protected animals. Keep them wild. Keep us safe.
All right, everyone. We've been talking about um, parental mental health and caregivers as well. And we're here with Dr. ODUYEBO right here talking to us about it. All right, doctor, we've been talking about, we want to put more emphasis, on parents. Like I said earlier, it has always been children, what benefits children, but people do not put, so much importance on parents as well, that they also have stress they're going through. So let's talk about um, parents now. How should parents, juggling different things, work, children, and every other stress of life, what are the coping mechanisms that parents could use, to have a little respite from all of this, like you said, the hardship in the country and the world. A lot is happening to parents. So how do they cope?
Okay, yeah, thank you so much. It's important that we know that parents are very important as far
Yeah.
as care of um, children is important, and so it's important that we understand that the mental health of the parents is very important, and they need to understand how to cope. That's the capacity to be able to do certain things that will help lessen the stressful events, the stressful problems. Stress will come, and stresses come anywhere, from anywhere. They can come from the system we're in. They can come from your workplace. They can come from your spouse. They can come even from children too. They can come from many factors, and it's important that we know how to cope with them. There are different types of ways we can cope. Once the problem comes, the problem has come, and we must handle it. There are problems that will go, and those problems that will go, we want to see how to solve it. But there are some problems that have come to stay. For example, a woman who had a child outside wedlock, that problem has come to stay. And so she must ask herself, how do I cope with this? Somebody who suddenly just lost a job, and a well-paid job, the problem has come to stay even then. So she should ask herself, how do I get out of this? So we have certain ways which we call the problem-solving measures that we use. You want to look at it and ask yourself, what's the way forward here? I must solve this problem. So in problem solving, we want to see how to solve the problem, the way forward. What many people do is sit down and think. And once you cannot cope well and you don't have a coping strategies, the person is going to come down with mental health challenge of any type. It may even be anxiety disorder. It could be anything. It may be depression. It may even be the outright psychosis. It may be that this person has an acute stress reactions or disorders and all that. And so it's important that we ask ourselves, what's the way forward? We mustn't stay where we are. We must see how to move forward. Recently, a psychologist was talking to an elderly person who lost his wife. And but in the last 2 years, he has cried many times. And it's been so difficult to forget, to at least not forget completely, but to get over it. He said, we've been together for 41 years. I don't know how to get over this. But the psychologist had to tell the person that, okay, it's happened. We must now admit that it has happened. There's nothing we can do about it. We can't get her back. What's the way forward now? And is that way forward that will help? Then another thing, you want to ask for help. Anyone, a parent or a caregiver who has any challenge with in any way, so as to be able to function well, must ask for help. What's the way out? Who is going to help me? For example, somebody who is so overwhelmed because there's so much work to do can get a care and order a smaller caregiver that can help assist some of those things. Somebody who needs help as far as finance is concerned, because that's more difficult to get people who will so willingly want to help. But somehow, if she sits down well, she will be able to get people who may help assist. So you want to say, ask for help. Don't be afraid to ask for help. Don't tell yourself you are a self-fixed or self-fix-it-all person and not ask for help. Then another thing, you look for information. Okay, there's a problem now. How have people who have gone through this gotten it? You know, people jokingly use the word, when you ask them certain questions, they say in Yoruba, they say, lo bigogu.
Yes.
You know, it seems very insulting. But you know what? If you really check Google, you may get some answers somewhere. Somebody may have gone through it and will tell you the way out. In fact, we may be shocked many people have gone through it and may tell you the way out. So you look for information, and then you can also confront the situation and say, okay, now this has happened. Okay, now let me see how to, if it has to do with a person factor, you can, for example, somebody is abusing somebody around you, somebody is abusing you, or somebody is doing something you hate, somebody is picking your things and stealing your things. If it's somebody you can confront, you tell the person, I don't think I like what you're doing. I don't think I like somebody is backbiting you and you said the worst things about you, you can confront, and not in an aggressive manner, but in a good manner. And we also have what we call emotion resolving, which when you ventilate, you look for right people to talk to. Not just people who will give you old wise fables, but somebody who will be able to give you right counsel, and maybe your spiritual leader in your church or your mosque or wherever it is you go. It may be a counselor somewhere, you know, who will probably tell you what while you ventilate and let them know. Then you want to evaluate the situation. You want to evaluate it, and that's more different from now looking for information. You want to evaluate, and there are some things we take up there that is really not. And you know, when you evaluate it, you just say, Kutobe, it's not as bad as I think. Because there are some times when some things get at us so strongly and we think it's so bad. We just need to sit down well. And then we find holes where, you know, you find that, okay, this is still there. Then I can go this way. Then another thing is positive appraisal. The Holy Book I read says that all things work together for good. The Quran may also have its way of saying a similar thing. But you want to positively appraise this thing. There are times that some bad things that happen to us actually are meant to take us further. I know of people who, during the times of the half salary for the state, actually got better and richer because all their neurons just opened. What else can I do? And you know, that thing has now made them blow the way the world will say, what's it blow? You know, that kind of a thing, you know, has pushed them forward. And so there are some challenges that come our way just that will challenge us, and those challenges are meant to push us forward. Then are there ways you can avoid somebody who is going to be very brutal, avoid some people who don't say the right things about you, avoiding situations in that regard, not to avoid the fact that you should visit your doctor when you should, because you don't want to hear what your doctor is saying, but you want to avoid.
We're constrained for time now, but I want to ask this particular question. You know, when parents are that much overwhelmed, how do children themselves come in to help? And the society, I mean, the immediate environment. You talked about a child that was rescued, you know, by neighbors. So how do neighbors help? How do children come in, you know, to help their parents out of the situation?
Thank you. When it's known that maybe a parent or a caregiver has a mental health challenge, or is in a particular type of mental health stress, it's important that the first thing is that the person should be aware, and these are avenues for the people to be aware that such things exist. And then the child can also see how to help. A difficult child that is causing problem to the parents can also now tell himself or herself, I need to stop this thing. This is affecting my mom. This is affecting my dad. I need to stop. If it's somebody taking substance, taking drug, and you find out that this is affecting your parents' mental health, it's important to tell yourself, I need to stop. So that's one of, and you are sure. Once that is done, it becomes a stressor is off, and the person can. And then let's assume it's a spouse who has just lost a partner, and in that, the children can also help and support so well in probably looking for another caregiver if it's an elderly person, or looking for or trying or making such a parents live with them so that they will not be lonely and then they break down and all that. And then the society can also, and the child also knows that in the hospitals there are people they call psychiatrists or mental health physicians that they can bring them to, and we have had some who bring their parents. In fact, just before I came, I was in clinic, and I still have about one or two who brought parents to the mental health facility. You don't leave them thinking that, okay, they are so well aware that they are sick. It's not all patients that, even though they are aware, some don't accept that they are sick. So follow up in such a way that you make them sure they come to the mental health facility. If you need to support them financially, you do support them financially. Neighbors can do the same. We've also had people in communities who bring patients, and they've taken the responsibility. Churches and mosques, can also take such responsibility and get people to the mental health facility, give them the support they need. And if some of their children or wards need to be cared for, they should. And then non-governmental organizations, it's not just about writing a proposal and telling the government or those agencies that you're going to do this. Please really do it and take care.
Doctor, I know you could go on and on, but we need to go now. Thank you so much, Dr. ODUYEBO, for joining us on the show today. We really appreciate. All right, everyone, it's been a show today on Spring Clinic on Western Spring Television. We spoke today about mental health, parental mental health, and caregiver mental health, and children upbringing today. And Doctor has really helped to shed light on all of the factors, causative factors, and how to prevent, or take care of all of these issues. You can watch, past shows too on all of our social media handles on Facebook, Instagram, and X. You can also watch us on YouTube on Western Spring Television. Spring Clinic is the show. My name is Timitope Ajijola Oluwala. Special thanks to all that came to put this show together. We'll be making a comeback next week. See you again. Bye-bye.